Assalamualaikum and hi, Teacher Aqilah here. So today I will be presenting on topic flat foot. Firstly, we will be going on through what is flat foot. A flat foot is a complex deformity illustrated by a flattening medial longitudinal arch of the foot. Flat foot is used to describe the position of the foot when the arch of the foot is low and the sole of the foot comes into contact with the ground. Flatfoot often called other names such as collapse or fallen arch. The medical term is pes planus. What are the types of flat foot deformity? Okay, in the pediatric population, there are two types of flat foot deformity, which are flexible and rigid flat foot. Okay, flexible flat foot deformity, approximately there are 95% of cases and is considered a physiologic condition, while rigid flat foot deformity, defined by significant restriction of subtalar joint motion, and this constitutes a non-physiologic condition often associated with pain and a more serious underlying pathology, such as tarsal collision or neuromuscular disorder. Tarsal collision is an abnormal connection of two or more bones in the foot. The bones affected that called tarsal bones are located toward the back of the foot and in the heel, and the connection of the bones can result in a severe rigid flat foot. While neuromuscular disorders affect your neuromuscular system, they can cause problems with the nerve that control muscles, human muscles, and communication between nerve and muscles. These disorders can cause muscles to become weak and waste away. Patients with neuromuscular disorders may also have symptoms such as spasm, twitching, and pain. So, what are the causes of flat foot? A flat foot that moves freely without stiffness is a normal presentation in some children and adults and is due to an increase in flexibility or joints and ligaments. There can be a family history of this foot type and it tends to affect both feet equally. In pediatric population, flat foot tend to be normal and pain-free, which is asymptomatic. Occasionally, there may be some itching in the arch or at the back of the leg on walking and physical activities. The causes of pain related to flat foot may be due to one of it was hypermobility, which is a term used to describe the ability to move joints beyond the normal range of movement. Joint hypermobility means that some or all a person's joints have an unusual large range of movement. People with hypermobility are particularly supple and able to move their limbs into positions others find impossible. Joint hypermobility is what some people refer to as having loose joints or being double joints. If severe, there may be the contributory genetic factor which may need further investigation from your general practitioner, which is a doctor based in the community who treats patients with minor or chronic illness and refers those with serious conditions to a hospital. Okay, another causes was weight gain, which is above average BMI. This may lead to increased strain on the muscles and ligaments at feet that leading to pain on walking. Another causes of flat foot of problems with foot development in the womb, which is congenital. Joints may not have formed correctly or bones may be abnormally joined together, which is fused. This leads to a rigid flat foot, which the arch does not appear when you rise onto tiptoes. This will require further investigation from your general practitioner or podiatrist, which is a medical specialist who helps with problems that affect your feet or lower legs. Okay, another causes was muscle weakness and tightness. A sudden growth spurt, which is a short period of time when they undergo physical change, that may lead to pain in the foot, sometimes caused by tightness in the calf muscles. And another causes was problems with footwear. Shoes with soft uppers and soft outer soles do not control motion around the heel when walking and can lead to increased strain on the feet. Another causes of flat foot was poor fitness, which is lack of exercise may lead to reduced range and inability for the foot to tolerate normal levels of activity. Another causes was The seven causes was neurological problems. There are conditions that affect the nerve supplying the muscles in the foot. This can lead to change in foot profile, causing weakness, stiffness, and altered sensation in the feet. And these conditions require consulting from the general practitioner. Okay, after we going through on what is flat foot, what the types and what the causes for flat foot to happen, we will be going on through what the treatments for flat foot. Most people can be successfully treated with non-surgical treatments. Okay, non-surgical treatments was one of the treatments for the flat foot, which is physiotherapy. Physiotherapy involves stretch for the calf and Achilles tendon and strengthening exercise for the tibialis posterior muscle and other muscles of the foot and ankle. Physiotherapy may also given exercise to strengthen upper leg, hips and core. This exercise improves ankle posture and reduce the pressure on the ankle. Okay, another treatment was exercise. Exercise are also a powerful tool to help manage pain. By strengthening the muscles and tissues, they will be able to better tolerate how hard and long they work. Simple exercise like going up onto tiptoes, stretching the muscles that support the arch. This exercise can be performed holding onto a stable, immovable surface or object such as worktop. Please ensure the floor is non-slip and check for any wet areas. Okay, the third non-surgical treatment was supportive footwear, which is wearing a shoe with a trainer or walking type shoe with a supportive upper, fastening that holds the foot firmly such as a lace, buckle or velcro fastening, heel height of no more than 3 cm, molded rubber sole, broad heel for stability. If have a diabetes, try and avoid a shoe that has seams that can rub the foot. This kind of footwear will help support a flat foot and lessen the chance of developing symptoms. The fourth non-surgical treatment for flat foot was activity modification. Okay, reduce any activities that cause pain such as prolonged walking and standing. Okay, another non-surgical treatment was immobilization, which is use a support boot for a short period to protect the foot and ankle. Another one was orthotics or insoles, provided with off-the-shelf or custom-made insoles to help support and correct foot arch and may help reduce pain. A short book, simple arch support insole may reduce the strain in your feet and help reduce any painful symptoms. In severe cases, custom-made footwear may be provided. The bespoke insoles or orthoses in certain cases, a podiatrist might prescribe an in-shoe insole to help resist pronation to positively influence pain or foot function in children. Okay, another non-surgical treatment that will be provided was ankle braces, used to support the ankle and reduce how hard the muscles are working. This may help with symptom reduction when used alongside supportive shoes and stretching exercise. Okay, another non-surgical treatment was pain relief. Always ask your pharmacist or general practitioner before taking new medication. Okay, paracetamol can help mild to moderate pain. Ibuprofen can be used for moderate pain and swelling, but avoid taking this if you have diabetes, stomach complaints, or problems with your heart. Ice is also a good pain reliever. Place the ice over painful areas for 10 minutes periods using a towel between the skin and ice to prevent ice burns and skin damage. Okay, using an ice pack regularly can help to reduce pain and swelling. Okay, the last non-surgical treatment that will be provided was lifestyle adjustment. Okay, keeping active and eating a healthy diet helps reduce unwanted weight gain. Okay, sleep 7 to 8 hours each night as pain is often worse without adequate sleep. Okay, another treatment that will be provided for flat foot patient was surgical or invasive. Sur- Surgery or invasive treatments may be done in very severe cases or those that do not respond well to non-invasive or non-surgical treatments. If these non-surgical measures do not settle set foot symptoms or patients have further concerns, it may be necessary to see an orthopedic foot and ankle consultant. They can discuss surgical management if appropriate. This comes with significant risks such as pain, infection, and reoccurrence. The treatments may be in the form of steroid injections to the tendon sheath or to painful joints, which the aim is to reduce pain in the first instance. Surgery may involve reconstructing the damaged tendon and or bone. It may also involve joint surgery to try and correct the posture of the foot to a near normal position. However, this can be extensive procedures with associated risks. Surgery will impact upon your everyday activities such as your ability to drive or exercise for 3 or more months and should always be considered as a last resort. That's all from me on topic flat food. Thank you for listening.